My name is Richard Sutton. I'm a consultant surgeon. I specialise in oncoplastic, reconstructive and cosmetic breast surgery. I considered lots of surgical disciplines before I decided to embark on a career in breast surgery. But what really swung it for me was working at the Royal Marsden Hospital in London through my early years in training as a surgical registrar. And I was really inspired to see the surgeons that my bosses were undertaking to help to reconstruct the breast after a mastectomy. For me, this was a complete revelation, focusing not only on cancer treatment, but also on the overall well-being of the patient. So what does oncoplastic, reconstructive and cosmetic surgery mean? Well, I specialise in management and diagnosis of all common related problems to the breast. So most commonly, patients would come and see me with concerns about the breast, either because they felt a lump, or they've got breast pain, or they've noticed fluid discharge from the nipple, or they're worried they've got breast cancer. But I also specialise in surgery to help to improve the appearance of the breast through cosmetic breast surgery. So they'll begin with a consultation and a physical examination, and then go on to have breast imaging investigations, which are normally undertaken the same day in the radiology department here at the Bath Clinic. So the imaging investigations are organised and assessed by a consultant who specialises in breast imaging, and that might involve having a mammogram, an ultrasound scan, and maybe a biopsy with a needle if they can see anything significantly wrong. So thankfully, most people who come with a breast-related problem are found to have something benign and harmless that doesn't need any treatment, and the patient can leave with simple reassurance that there's nothing significantly wrong, such as hormonally related breast pain or a simple cyst in the breast that might need to be aspirated with a needle. Other patients, though, may need more thorough investigation through additional investigations, such as through a biopsy or additional scans, such as an MRI scan. And for those patients who are found to have breast cancer or the precursor to breast cancer, then we have absolutely cutting-edge, state-of-the-art treatments available for patients in the Bath area. So I work closely with my colleagues who specialise in the management of patients with breast cancer in the Bath area. This involves oncologists and pathologists and our expert breast care nurses. So the treatments for breast cancer are evolving and improving all of the time on multiple fronts, including anti-estrogen therapy, including different chemotherapy regimens, including multi-gene array genetic profiling of breast cancers to try and exactly tailor what's best for the patient. But from my own front, there's been huge strides and improvements in the surgical treatment for women with breast cancer. We're trying more and more to improve outcomes through the surgical phase of treatment for women with breast cancer. More and more patients are having breast conservation surgery with clever new novel techniques to try and help maintain the aesthetic appearance of the breast whilst adequately treating the breast cancer. That's a really difficult one because there are so many amazing stories that it's difficult to focus on one. But when you meet a woman 5 years after their breast cancer treatment and they're in a supermarket with their 3-year-old child, and you've seen the positive impact that that's had on saving that patient's life and helping them to have a family, I don't know what else to say on that one, really.